Christy Call, Editorial Director of Cure Magazine. In this edition of the Speaking Out video series, on behalf of the National Pancreas Foundation, we're talking with Dr. Diane Simeone from NYU Langone Health about genomic risk factors associated with pancreatic cancer. Hi, and welcome.
Hi, it's a pleasure to be here.
Thanks. So to get started, how does family history play a role in the risk for pancreatic cancer?
So obtaining a family history is actually critically important in evaluation of patients with pancreatic cancer. What we have determined over time is that when a thorough family history is obtained, we clearly identify patients who are at heritable risk for pancreatic cancer that perhaps wasn't appreciated. So we've really been an advocate of a thorough family history for patients with pancreatic cancer, and in fact, a thorough family history for all patients that are seen by their physicians, so that if there are any clues that someone might be at risk for a heritable cause of cancer and pancreatic cancer, that it's picked up.
Okay. So with that, what would this history consist of that would hopefully flag somebody for their familial risk of pancreatic cancer?
Well, you'd be surprised at how many people out there have family members that have a history of pancreatic cancer. So right now there's a definition of a familial pancreatic cancer family as a family that has 2 or more members with pancreatic cancer, with at least one of those members being a first-degree member. And by that, I mean a parent, a child, or a sibling. But what we also find is there are many people that are a little bit more in the gray zone, where they may have multiple members in their family of pancreatic cancer that it might not necessarily be a first-degree relative. So I think we're still in the learning phase of determining who's really at elevated risk for pancreatic cancer. But importantly, we want to try to make sure we record that information, so as we learn going forward, that will help us ascertain who are the appropriate people to get screened. It's also important to know that there are other cancers that can be tied to pancreatic cancer, and so it's important not just to ask if family members have had pancreatic cancer, but if they have associated cancers like breast cancer, colon cancer, and melanoma. Breast cancer for mutations in genes that are called BRCA genes or the PALB2 gene. Colon cancer, because there can be an association between colon cancer, Lynch syndrome, and pancreatic cancer. And there's a tumor suppressor gene called the P16 gene that can cause familial melanoma and pancreatic cancer. So really having a comprehensive family history helps a clinician start to sort that out, whether someone might be at elevated risk.
Okay, and so I know you had just mentioned, the BRCA gene mutation with breast cancer. Can you discuss some of those genetic mutations that are associated with pancreatic cancer?
Sure. So as we delve into this area a little bit more, we're actually uncovering that more patients with pancreatic cancer than we previously appreciated had a heritable risk. We talked about family history, and getting a thorough family history is important, but we actually embarked on a large study a number of years ago to do genetic testing, or what we call germline testing, of all of our pancreatic cancer patients. And this was a large study we started at University of Michigan and carried out at NYU. And what we found is 15% of all pancreatic cancer patients actually carried a known mutation that put them at risk for pancreatic cancer. Now, in some of those patients, there was a family history that went along with that, but we've also found in patients who didn't have a family history that would suggest they had a heritable cause, we also found germline mutations. And so with that, we've now pushed forward to establish guidelines that all patients with pancreatic cancer should get germline testing. And just to be clear what I mean by germline testing, that's getting a sample of blood, and from that blood there are white blood cells in the blood, and you can isolate the DNA, and you, through a commercial assay, look for mutations in a set of genes that are associated with increased risk of pancreatic cancer. The most common ones people have heard about are the BRCA genes, BRCA1 and 2, which are also linked to breast and ovarian cancer. But there are other genes out there, about 15 in total, that have been identified so far that are associated with increased risk of pancreatic cancer. ATM is one of those genes. Lynch syndrome, where you can have mutations in mismatch repair genes. And then there's a number of less frequent germline mutations. It's also important to know that this is still an area of active investigation. Even in families that we see that we know that they have a number of members with pancreatic cancer, when we test for the known mutations associated with risk, that assessment might come back negative. And I think it's because we still are in the discovery phase of identifying all the genes that are associated with pancreatic cancer risk.
And so I know you had mentioned, discussing your family history with your primary care physician so that way they know. But moreover, why is it important for families to also be having these discussions so that hopefully they're raising more awareness about this potential risk?
I think there's been a tradition of a lot of nihilism about pancreatic cancer risk and screening, where it's been thought, even if I am at elevated risk, there's nothing that can be done about it. That is, in fact, not true. There are now a couple studies, each with 200 to 300 patients, that show for patients who are at elevated risk, if they're in a screening program, our ability to pick up an early pancreatic cancer, should it develop in that person, and resect it surgically, approaches 90%, as opposed to the typical patient with pancreatic cancer who comes in our clinic, where only about 15% of patients are candidates for resection or removal of the tumor because the tumors are more advanced. So we have growing body of data that shows that screening finds earlier cancers with a much higher likelihood of cure. And as a surgeon, I can tell you that our ability to move towards long-term survival is going to be much higher if we kind of shift our whole thinking about really identifying who's at risk out there and make sure appropriate at-risk patients are put into screening programs.
Okay. And so with that, why is genetic testing important to be done? And then who should be getting this testing?
So genetic testing is really something that needs to be done with higher frequency. We're finding, especially since the cost has come down pretty dramatically over the last several years, that you can get a high quality genetic test for $200 or $300, as opposed to the old days where it was a $4,000 or $5,000 test. So with a relative low cost, and insurance often covering that cost, we can liberalize who gets testing. We even offer testing to people that have a single first degree or second degree family member with pancreas cancer, because the cost is low and the yield, which is about 7 to 8%, can be very impactful for that patient. We have definitely found patients who have germline mutations, even with a single family member with pancreas cancer. I think highlighting that increasingly deploying this kind of test is going to better help us understand who out there is at risk for pancreatic cancer and should be screened.
Okay, great. So I know we focus a lot on family history, but how can also a history of diabetes or pancreatitis put a person also at risk for pancreatic cancer?
So you bring up an important point about the link of two diseases with pancreatic cancer. First, let's discuss diabetes, and then next we'll tackle pancreatitis. Diabetes is definitely linked to an increased risk of pancreatic cancer. There's kind of a twofold relationship between diabetes and pancreatic cancer. The first is if someone has long-standing type 2 diabetes, that increases their risk of pancreatic cancer about twofold. So here we're talking about somebody who's got type 2 diabetes that has the disease for 8 to 10 years. So that's one category. Also, sometimes pancreatic cancer presents with new onset diabetes, especially if it's associated with weight loss instead of weight gain. And in people over the age of 50, that should be a little bit of a red flag. If you have new onset difficult to control diabetes associated with weight loss, that can be a sign of pancreatic cancer. Importantly, research has shown that may happen 6 to 9 months before someone develops any other signs or symptoms of pancreatic cancer. So that's a really important thing for patients to know about, and also for primary care doctors and internists and gastroenterologists to be aware of that association. Now, let's talk a little bit about pancreatitis. So pancreatitis is inflammation of the pancreas, and it comes in two forms. You can have acute pancreatitis, which is often brought on by either gallstones or heavy alcohol use. We have an episode of pancreatitis and it resolves. We don't know if there's a relationship between an episode of acute pancreatitis and pancreatic cancer risk. Alternatively, folks can have what's called chronic pancreatitis, where they have chronic fibrosis and inflammation of the pancreas. And there are different causes of chronic pancreatitis. Sometimes it's genetic, sometimes it's due to heavy, long-standing alcohol use. Sometimes we don't know what the cause is, but in those patients, they can also have about a twofold increased risk of pancreatic cancer. Another point to bring out is sometimes a pancreatic cancer will present as a bout of pancreatitis. So anytime a patient has pancreatitis, it's important they get a thorough evaluation by their physician. And then certainly if it's a little bit of an older patient, unexplained pancreatitis, sometimes it's due to a tumor that's blocking the pancreatic duct that causes pancreatitis.
Okay, and so if an individual does have any of these genomic risk factors, what should they do?
Well, I think it's important that you see a physician that have expertise in this area. And importantly, the National Pancreas Foundation has identified pancreatic centers of excellence around the country, so that if you're in any part of the country, you should be within striking distance of a center that has expertise in pancreatic diseases. So that's really important, to make sure you see a knowledgeable physician.
Absolutely. Well, thank you so much.